I'm pleased to see that an event like this is happening because it's bringing the people together who may be able to mount some kind of strong voice against this race to the bottom where the government pander to the needs of a very strong industry. It's a very multifaceted industry with manufacturers of different products, different types of retailers who want better market conditions. And the more efficiency that goes into the alcohol market, the more efficiently we consume alcohol and the more efficiently it does us and our families harm.
It is our favorite drug. We have a love affair with alcohol. Almost 80% of Canadians drink 15 and over. It's how we relax, we reward, we celebrate, and if you get into trouble, you drink to numb.
So as a family doctor, you see it in family disruption and violence and illnesses, and then now as public health, I look at a population, but I see a population in a rural area that has more injuries than average because they drink and drive and because they work and drink. And you also see fetal alcohol spectrum disorder because the young mums will drink as well.
Well, there's certainly urgency now that the government has made changes related to the sale and distribution of alcohol. So on the one hand, we applaud the government's commitment to saying that they will put aside a percentage of those revenues in order to tackle this issue. On the other hand, we're calling on the government to not do further expansion because as we see further distribution, it leads to increased consumption, which leads to increased harms.
As the Associate Minister of Health and Long-Term Care, responsible for, among other things, wellness, getting our alcohol policy right is a very important part of my mandate.
Public control over alcohol retailing has been identified by a WHO working group as one of the most effective ways to control alcohol-related problems.
If you have a government system, you can more efficiently and effectively introduce changes in control under that system than you can under a private system.
The private sector is driven only by a profit motive, where a government monopoly has to take account other things. The challenge we have, even if you have a public monopoly which is driven mostly by a profit motive, which is the current model in Canada, then you're getting closer to that private model, and that's what's creating many of the challenges right now in alcohol policy in Canada.
British Columbia has experimented with partial privatisation. We still have almost 200 government liquor stores, but we now have about 900 types of private liquor outlet. Like Ontario, we're now adding grocery stores. And our research has shown that at a local level, the more private liquor stores or the more agency liquor stores, not the government stores proper, but the ones that may be franchised out, that you get, the more consumption there is in that area, the more deaths from alcohol and the more hospital admissions caused by alcohol in those areas.
There's lots for men, there's lots for women, and there's no oversight on marketing. And we know all too well that there are 3 levers that we can push on that changes the way we drink. And one is marketing, and one is accessibility, and one is pricing. And the fact is, accessibility, the gloves are off. We have lost the plot in this country.
Most of us take for granted how safe our roads are. The fact that we go to and from work, we go to and from soccer practice, and we get home safely. We have 9.4 million licensed drivers in Ontario. That's a lot of drivers. And every year we are first or second safest in North America. And that's because of our policies.
When we say responsible retailing is job number 1, we really mean it. LCBO made Ontario the first jurisdiction in North America to have a comprehensive training program for people who sell alcohol to make sure that sales are not made to people who are under legal drinking age, who are intoxicated, or people who appear to be making a second-party purchase on behalf of someone who's underage or intoxicated. And we have a rigorous training program in person with discussion about different ways of handling situations with role-playing. And it's something that we work on continually in our stores with our staff.
For about, I'm told, about $500,000, which is about 1 hour's profit that the LCBO gives into the government. You could convene a panel of independent experts, and I would submit with academic freedom to study alcohol in Ontario today and come up with some recommendations and on a way forward. Because we're liberalizing alcohol sales in Ontario, I think, without having done due diligence.
We have to find ways to mobilize both and influence the politicians as well as the community action piece. And certainly we're in a room where we have people who are in position both to be providing advice to the decision makers and their technical expertise.
And I worry that with the rest of Canada, we're sliding into what in alcohol policy terms would be like dark ages. And I've worked in the UK and Australia, and I've seen how bad it can get. And seems things have to get very bad for us to remember again collectively why it's important to have continuing concern and sensible modern restrictions on price and availability so it minimises the harm to young people and the community at large.